Hi, this is Ken with Individual Health Solutions, and today I'm going to spend a few minutes talking about Medicare, introduction to Medicare, and really talking about when someone should start planning and thinking about Medicare. In other words, how much time should be used in advance to start that process. So we start with the parts of Medicare, and there are technically four parts of Medicare. There's A, B, C, and D, but in reality, when someone is ready to sign up for Medicare, which happens to be either when they turn 65 or if they continue working past 65, but and then come off an employer plan. At that point, they would go to Medicare. We're really in the beginning just focusing on two parts of Medicare, Parts A and Parts B. So Part A is the hospital insurance coverage under Medicare. It includes some other things, but for the most part, think of Part A as being your primary hospitalization under Medicare. The information that I'm reviewing today represents 2022, so the year 2022. So these numbers change a little bit every year. Under Part A, there are deductibles and daily amounts or daily copays that are passed along to the Medicare recipient. So for 2022, the deductible for each hospitalization within a 60-day time frame is $1,556. So if there's two hospitalizations within that 60-day time frame, that individual is responsible for just one deductible. However, if it exceeds 60 days, then that would be a secondary deductible. Second cost that is passed along, which could be much more significant, would be if someone's in the hospital longer than 60 days. In that case, what happens is it moves then from a deductible into a daily copay. So for days 61 through 90 in the hospital for the same situation, same medical condition, that individual would be responsible for $389 beginning on the 61st day. Part A of Medicare, most people will not pay a monthly premium for Part A. And that is for anyone that has paid at least 10 years into payroll income tax, into Social Security, then Social Security tax, then their Part A, including theirs and their spouses if they have one, would have no cost for Part A. The second part of Medicare would be Part B, and this is considered medical insurance. So think of Part B including essentially everything except hospitalization, which is Part A, and prescription coverage. Prescription coverage is handled elsewhere, but everything else primarily is a component of Part B. So doctors and outpatient surgeries, lab works, if someone had to get an MRI or a CT scan, those would all be components of Part B. What's passed along to the recipient under this coverage would be, there are two different costs that are passed along. The first would be a yearly deductible of $233, and then the second cost would be 20% coinsurance that the recipient is responsible for. So Medicare would pay 80%, the recipient is responsible for 20%, and there's no out-of-pocket maximum under this coverage. So for example, if there was a $100,000 Part B expense, that individual would be responsible for $20,000. Part B does have a monthly premium. It's based on the individual's income. And what will happen initially is that when someone signs up for Medicare, Medicare will look back 2 years. So in 2022, if someone enrolls into Medicare, Medicare will look to their 2020 income tax return to establish their adjusted gross income. So for example, if I'm looking at the second column under filing a joint tax return, and let's just say that in 2020, the adjusted gross income was in that second category, that 100 or above 182,000 up to 228,000. Over to the far right, that individual's monthly Medicare premium would be $238.10. Now, because of this retro look back, there are exceptions that an individual is eligible to file requesting that Medicare use their current income going forward as opposed to having a 2-year look back. And what is very common is someone moving to Medicare, they're retiring, their income 2 years prior was much higher than it will be going forward. Medicare allows for that exception. So in the event, in this situation, let's just say that going forward, this couple would be in the 182,000 range or lower. That individual would have a monthly Medicare Part B premium of $170.10. And again, this is per person per month that has Medicare. If someone remains in a higher income level, not only will they have a higher Part B cost, which was the previous slide, but they'll also have an added cost on top of any other prescription costs that they have. So these additional costs would be on top of a standalone prescription card that someone would have. Enrolling into Medicare can happen once someone turns 65, and it actually begins the 3 months prior to their 61st or 65th, birth month, and any time applying within those 3 months before. So, for example, let's say somebody is turning 65 in February, they would actually be able to start the enrollment process in November of the previous year. So November, December, and January, the 3 months before their 65th birthday, they can apply for Medicare, and then that coverage will go into effect on the first of the month that they turn 65. And there is one exception to that, and that is if someone's date of birth happens to be the first of the month, then their Medicare eligibility is actually moved up a month. So if my date of birth is January 1st, I'm actually eligible for December 1st for Medicare. Once someone does enroll into Medicare, they have basic parts of Medicare, which are the two parts that I've just reviewed, A and B. And without anything else, there would be significant cost to that individual that they could incur. And Medicare does not include any coverage for prescription. So there are two ways that someone can go to round out or supplement their coverage. The first would be this option on the left, and that would be to add in a Medicare supplement, which is an insurance policy that would pay on the member's behalf their Part A deductible, any daily copays that incurred for over 60 days. It would pay the 20% coinsurance under Part B. It would pick up some foreign travel if that rider was added. It would round out Medicare and the costs that that individual would be responsible for. And then in this situation, there would be a prescription card that would be added known as Part D. So under this first option, under Original Medicare, there are three parts of Medicare. Part A and B would be the primary medical coverage for this individual, and then the supplement would be the secondary to the primary, and then the prescription coverage is added via the standalone Part D drug card. The second option, which would be the arrow to the right, would be someone that would choose a Medicare Advantage plan. And a Medicare Advantage plan is a private insurance policy administered by an insurance company, and that insurance company becomes responsible for all of that Medicare recipient's health care. So for everything from hospitalization to medical coverage to prescription coverage is being administered and paid for by the insurance company that has offered that plan. So in the situation, the insurance company becomes solely responsible. What happens is Medicare subsidizes the cost or almost the entire cost of that Advantage plan premium directly to the insurance carrier to offset the costs that that insurance carrier will incur by managing that person's health care. So Advantage plans are copay driven. So if I have an Advantage plan, I will have copays for various services, including specialist doctor visits, hospitalizations, outpatient procedures. Most medical items will have a copay. All Advantage plans have maximum amounts not to exceed. So, for example, let's say that you have an Advantage plan that has a $5,000 not to exceed. That's the most that that individual could spend over the year in combination of copays under that plan. And then finally, most Advantage plans will include additional benefits for dental and vision and over-the-counter. And so when we work with individuals that are preparing for Medicare, we want to look at both options, Original Medicare, so the arrow to the left, and Medicare Advantage, arrow to the right. And we really want to talk through the pros of either option. In some cases, it's clear that the better choice would be an Advantage plan for some people, and in some cases, it's not. And we really want to make sure that the individual is choosing the right option once they move into Medicare. One, because it's important that they have the right coverage, and two, there are some guarantees that go away after the initial enrollment into Medicare. So in other words, if someone decides or elects to start with an Advantage plan, they have a limited time frame where they could switch over to Original Medicare under their initial enrollment guarantee. After that time window, that guarantee goes away, and the individual would need to answer or be required to answer some medical related questions in order to apply for a supplement under that original part of Medicare. So these are the things that we really want to look at when someone is planning to enroll into Medicare. And then finally, the last slide that I want to go through is just considerations. If you're 65, turning 65, and you're thinking about working past 65, what's really important is, does your employer have 20 employees or more? If they do, then that plan, the employer plan, is primary to Medicare, and you could stay on that plan. Are you on a health savings account? If so, that will bring up some restrictions with your choices for Medicare, which we would want to review with you, because the IRS does not allow someone to be enrolled in any part of Medicare and contribute into a health savings account with the pre-tax benefit. There's an enrollment look back. So if someone is older than 65 and signs up for Medicare later than 65, there is a retro enrollment for Part A that we want to make sure we sync up properly, so that if somebody is receiving or putting money into a health savings account, that we make sure that they're not contributing based on that retro look back. COBRA, when you do retire, COBRA most likely would be offered, and that is not creditable under Medicare. So staying or remaining under COBRA after turning 65 is not really a viable option. And then retiree coverage, if you're offered retiree coverage, it would always be, or usually always be, secondary to Medicare. So you would still need and want to sign up for primary Medicare, but then the retiree coverage would most likely be secondary. So I hope this information was helpful today. We would love to talk with you about your planning for Medicare. All of this information will be saved on our website along with our contact information, and I really appreciate you listening and taking the time today. Take care.